really believe that we in America and in Florida are in one of the most challenging, transformational, disruptive times in healthcare in probably 100 years plus. Where have we been, where are we today, and where are we going tomorrow, and why? The pace of change is accelerating. So if we are not adept and open and recognizing all of the transformational changes that are occurring around us, we're going to potentially be left behind. And the same thing is happening in healthcare. Healthcare is about 18% of the United States GDP. We are an incredibly unhealthy nation. Nearly 2/3 of Americans are overweight. Nearly 1/3 of Americans are clinically obese. So we came up with what we define as the dynamic flows of the new health age. The high-level structural changes so that you can think about healthcare in the 20th century model and what's going to be different in the 21st century. And we divided these dynamic flows into 3 categories. One is how we think about healthcare will change. 2, how we deliver healthcare is going to change. And 3, the economics of healthcare are going to change. And I would pose this proposition that moving forward, as you try to analyze what does your medical practice do to adapt, confront, and prosper in these transformational dynamic times, the issues and the questions and the answers are going to fall somewhere in these dynamic flows. The 20th century modality was to pay the continuum in healthcare for treating sickness. Are we going to eradicate sickness in the 21st century? Of course not. But if we are at nearly 18% of GDP spending on healthcare, and the private sector is saying we can't pay anymore, and the taxpayers are saying we can't pay anymore, the system has got to readdress how it's applying that spending. In the 21st century, physicians in the room will start getting paid for wellness and keeping patients out of the more expensive modalities. I have transformed my life. About 3 years ago, my doctor, Dr. Robbie Schulman, sat me down at 41, 42 years of age and said, "You're my patient, you're my friend, you have pre-metabolic syndrome." I had no idea what metabolic syndrome was. What is that? I don't have to tell the audience what metabolic syndrome is, but he got me engaged in transforming my life, and that gave me a new awareness and a new understanding of a world that I honestly had no idea what I was doing to my body. I had no idea of what metabolic syndrome was, and that having high blood pressure, high blood sugars, high cholesterol, all combined together to metabolic syndrome would put me into the world of chronic disease and put me at a higher risk for so many cancers and other very, very harmful diseases. I had a new awareness and new understanding, and I am now thinking about my doctor differently. Dr. Robert Schulman is who I now talk to about staying well. I could talk for an entire day about how the healthcare system that functioned in opposition in the 20th century is doing more and more to come into alignment. If I can bat .333, hit 35 home runs a year, day in, day out, I'm going to make more money on a baseball team than a hitter at 200 who hits 12 home runs a year. Now, we don't have to like that system, but isn't that the system? And that is what is coming to healthcare. So for physicians who can come to that realization, you will do better in the 21st century model than you did in the 20th century. Probably 80% to 90% of my healthcare practice as a lawyer, as well as a strategic advisor now to healthcare companies and of all sorts across the country, is around integration. I had a physician group that was about to integrate with a hospital system until the hospital system said, we're not going to take your EMR system and we don't have an HIE to connect with it, so you're going to have to go back to paper records. Absolutely killed the deal, because they had gone through that transformation to an EMR platform, realized the benefits at multiple levels that that gave to the practice, and there was no way they were going back. And they would have made more money under the hospital's compensation system, but they said it was absolutely not worth it. Medical homes. Medical homes are not physical structures, but medical homes will be the model that American patients will start to look for from their doctors, from their hospitals, from the entire system. Where do I go for wellness? Where do I go to learn how to prevent disease? If you embrace and figure out that the world is changing and move towards the dynamic flow changes of the 21st century, there are models after models after models to follow to where the patients win because the outcomes improve, the payers win because the costs are being controlled, and the physicians win. And hopefully this high-level presentation has helped a little bit identify where we've been, where we are today, where we're going, and why, so that as we do confront these very, very challenging times, moving towards these transformational new dynamic flows, you can be on the winning team of where we're going. I oftentimes get asked, is America ready for a world of wellness? Do Americans care about their physical health? The goal of the Race to a Healthy America is to make America the healthiest nation on earth by 2025. That's why Dr. Oz is on the cover of our book, because that's where the new health age is taking America. What does that tell you about Americans and what they want to see out of their lives and their lifestyle? All we gave them was a chance to get active. Race to a Healthy America. And businesses got engaged so that their workers can move towards this new world of health, wellness, to bring down healthcare costs and to, by the way, increase worker productivity. We are living through transformational times, and I really believe that for many of you in the room, you can take advantage of these changes and succeed. And hopefully the book will help you along the way. So thank you very much.